In this video, we will now adjust all the attributes that we've learned about in the previous videos to different types of diseases. We'll look at PEMF and depression, cancer, osteoporosis, sleep, dentistry, and inflammation and immune stimulation so that you know how it actually works. Now, in regards to immune stimulation, let me show you this little video that we made after a client was activated during a workshop with a 15-minute treatment. Now you can see the white blood cell here. It actually touches each cell, each red blood cell, checks those red blood cells whether they are okay, whether they have a good system, and it's like they read the DNA and it's moving through. So I'm winding back and you can see that. But this is an active white blood cell. You can see there is others down here. That's actually an image of somebody who has probably quite some high infection or inflammation, because there is, in a very small place, quite a number of white blood cells. And you can see all of them are working, all of them swiveling around, chasing bacteria and whatever, and moving through. And this is an active white blood cell. Now let me just go and reduce that back to size, so that we can move on to the next. This is one which was done with a much better microscope than mine, where you can see how they chase actually a bacteria. Let me just enlarge that as well. Oops, bring to front. Now you can see it's actually chasing here this bacteria and follows through until it catches it. And then it eats the bacteria. And you can see here in the back, all those little residues. That's the digestion system, the digestive system. The membrane up front touches each cell, reads the DNA. Is that a healthy cell or is it an unhealthy cell? Is that something that belongs to the body or not? And when it recognizes that it's something that doesn't belong to the body, those white blood cells eliminate them. And this is happening in your body with trillions of those white blood cells. These are called macrophages. So they're really important. You need to have them, and you need to have them working in absolute perfection. Now, if they are tired, if they are not working, and look at this soldier here, I call these white blood cells our soldiers, our defense system. If they are not working properly, then nothing works. You are susceptible to infections, to bacteria, to fungi, to mold, to cancer. Everything can thrive in your body. That's actually what happens when you die. When your white blood cells stop working, all of a sudden your, the gut bacteria and everything that we have in us starts to thrive and eat up everything else. Now those white soldiers, they come in different forms, and there is many different forms. And you know, macrophages, white blood cell is what we know, but we can activate them. And this is what many clinics do. They create an extreme nourishing environment with lots of oxygen, lots of good nutrients, and activate them into dendritic cell. Or then you have the follicular dendritic cells, very high. They are the Marines. They are like the super soldiers. And then you have here elite troops, and then you have here the army. So that's what we all want in our body to work at optimal performance. And these white blood cells are here in this chart, for example, highly compressed, immobile, and imagine they are like this soldier, completely emaciated, no nutrients which go into the cell because the cell membranes are blocked, and no waste product goes out, so they poison themselves with lactic acid and they become highly acidic, so they don't work. It's like a soldier being stuck in the mud with no oxygen and no nutrients. How do you imagine them to fight a battle? Whereas if you start using PEMF, you increase nutrient uptake, you increase nutritional value in the cell, energy value in the cell, plus you detoxify the cells so they can breathe, so they have oxygen and nutrients, and they become super soldiers. Now, many of those white blood cells actually need zinc selenium as a tool to kill cancer cells. So when the nutrient all of a sudden can go into the cell, it's like you give them weapons into their hand. They get a gun to shoot cancer cells, to kill off bacteria. And that's why this whole system works so much better when you change that environment of your white blood cells. And that's why immune stimulation is the very first effect that you will realize from using this treatment. The second thing is when you use PEMF for inflammation, and we know inflammation is something that we all have. It's, let's say you have a splinter, and then that splinter gets infected and you have that bacteria came in with the splinter, and then you have that red circle around it which gets really hot. Well, that's the healing reaction of your body. The reddening is actually where your body opens up blood vessels. It's a very simple process. Well, simple, it's very complex if you look at the detail, but your body opens up blood vessels, widens the blood vessels so that more blood can open up into that area. And then it brings huge amounts of white blood cells into that field. And then sometimes you see that little white pus. That's when all the things are eaten up and the white pus is dead cells, and all the toxins and everything that came in is then eliminated to the outside, or it's transported off internally. But this inflammation is what is a healing reaction of the cell. Now, when you look at PEMF, what it really does, it activates your immune system. So for virus and bacteria, which are the main causes of inflammation, that's taken care of. Also parasites are activated, your immune system, so that takes care of parasites. When you look at the secondary effect that causes inflammation, it's heavy metal toxicity, which we all know is detoxified dramatically with PEMF. Then the deficiencies, which cause inflammation on their own, are taken care of by vibrating the cell and cleaning up the channels so they can take up nutrients. And then you have the healing and repair, which is stress and trauma, which is reduced as soon as you go into those low frequencies. You allow your body a very deep, painful sleep, and through that the relaxation and health. So inflammation, and a lot of people have asked if you have hip replacements, if you have inflammation from implants, from shoulders, those joints, even if it's titanium, don't worry. Internally, inflammation is drastically reduced. We have several clients who have hip replacements, who have screws or joints with metal in their body, and they use PEMF to reduce inflammatory processes. When you have breast implants and there is an infection or an inflammation and you use PEMF, in the same way it reduces and it increases the transport, the healing reaction dramatically. So there is no problem for any kind of surgical procedures that might prevent that. The only thing, which we said before, if you have stents or bypass surgery or any of that, you need to be careful that you don't use the strong device, but rather stay with the oscillating devices that will not cause any damage or any harm there. PEMF in cancer, we all know, and for those of you who have been in our database know that there is many causes of cancer, many things that suppress our immune system. This is actually a little white blood cell sleeping here happily after it had too much to eat and too much to drink and not enough exercise and too much stress, that poor policeman, and now he sleeps and cancer cells can take over. And we try to visualize things so that everybody can understand it, but when you look at what PEMF can here do, it decreases deficiencies, it decreases the infections, it activates your hormone glands to work properly, it reduces inflammation. It doesn't have an effect on what you eat. So if you keep eating junk food and lots of sugars and lots of carbohydrates, it won't change that. That's no influence. But oxygen uptake, toxicity, we know, alcohol, the same as sugar. DNA impairments cannot be repaired, but you can activate the nutritional factor. For example, a lot of people have an impairment to produce glutathione within the cell. Now we know we can give as much glutathione into the body as we want. It will not be taken up into the cell and it won't have an effect because it can only be used when it is produced in the cell. So when you use all the nutritional foundation, the base elements to create glutathione and you provide them into the body and you increase the uptake with PEMF, then DNA impairments can be bypassed in that form. Acidity is to do with your diet and cannot be changed, but it will be influenced because you reduce the stress level and the inflammation out of the cell, which is a big factor of acidity. Also, by reducing stress with PEMF, you create less acidity, and because stress causes your body to become acidic. So there is many factors that are directly related to PEMF in order to reverse or to heal cancer. But we don't say that. You remember, we boost our immune system, we increase oxygen uptake, and we nutrify our cells, and through that you will reduce the cancer load and your body can heal. There is another factor in regards to cancer and PEMF. If you use the strong device, the PMT 120, and you really push massive loads of energy into that body, your healthy cells have a very beautifully constructed membrane. The membrane is flexible and can take up huge amounts of energy, whereas a cancer cell is so fast produced and so unstable that it has no other nutrient channels than glucose. And they're very wide. If you think back at the image, let me just see if I can find it fast. The image of the cell, you see the glucose transporters, they're very big compared to all the other channels. So they have loads of glucose channels and very little of the others. So when you start bombarding this cell with big energy, like they do in the Paracelsus clinic and many other clinics with those high concentrated coils, then you will see that the effects on those cancer cells are so massive that they deteriorate. And look, a healthy cell will always just feel better after PEMF, whereas a cancer cell slowly disintegrates. And it's not like you kill all of them at once. It's not like, you do 2 or 3 treatments and all of them die. It's a gradual layer by layer by layer treatment. And that's why when you go to the clinic, you have every day 2 treatments, one in the morning before, one in the evening after. And in the Paracelsus clinic, you even have treatments in between with oscillating devices to boost your immune system and to relax you and to calm you down. So it's a phenomenal process and very, very important in cancer treatments at all. PEMF in wound healing. Dr. Finn Scott Andersen was one of the pioneers in that field, and I've spent some time in Humlegarden in Denmark with him. Unfortunately, he passed away 2 years ago, and it's very sad. It's a big loss because he was very, very successful in all of his treatments. And what he showcased is that when you have PEMF or without PEMF treatment, when you have overall generalized PEMF treatment, wound healing is only expedited slightly. But when you have targeted PEMF treatment, the effects are many-fold increased. And this is what we want. This is why we actually offer this device here with a little coil, with a little cushion. This is 1,000 Gauss. Very small, very narrow, and fully targeted treatment. So when you put that over your liver, when you put that over injury, when you put that over an organ that needs to be treated, you have maximum power in a very, very small place. Whereas you can connect to this device also the big mat. And then you use the mat for overall immune boosting and detoxification, energizing, but you use the coil for targeted treatment. And especially in the area of wound healing, you want that small area and a very targeted, very high power device, which the PMT will give you all the time because it's 39,000 Gauss. But this coil brings 1,000 Gauss. So it's very, very strong and very powerful. And if you turn it on, I have a video that I will put underneath where you can see I'm standing 3 meters away with a PEMF meter, and the needle still goes into full exhalation when we turn on the device. So they're very, very powerful and will penetrate your body tenfold backwards and forwards. So it's really powerful. There is some studies on PubMed that show that targeted treatment works. And targeted treatment is also necessary in order to achieve those very, well, super soldiers in your body, to activate them to a strong degree. PEMF and depression. Now, if you have been with us for a while, you know that we don't see depression as, you know, a system problem with nerve cells. It's an overall cause of many different things which triggers depression. So it's to do with nutritional deficiencies, and there is many, especially phytonutrients, that when you miss, you won't have the possibility. When you have B complex, when you have B12 missing, all of that will have a massive influence on your mind and mood. Your imbalance in neurotransmitters will cause that. Then we have allergies and food sensitivities in your gut. We know that emotions live in the gut. If you have an imbalance, a dysbiosis in the gut, it will cause depression. There is so many congested liver. If your liver cannot detoxify, if it's congested, if it's stuck, if you have too much alcohol, too much glucose conversion, all of that will cause depression. Then we have methylation, MTHFR impairment, lack of exercise, toxins. Heavy metals can make people completely imbalanced and cause so heavy depression. We've seen that when somebody has their mercury removed out of their teeth without any precautions by an uneducated and unqualified, as I call them, dentist, they can afterwards fall into the deepest depression with mental problems and everything. So toxins. Then we have stress. Stress usually changes your gut milieu, makes you acidic, activates a lot of the neurotransmitters, so that can be a big problem. Then you have gut health. We spoke about that. Deficiencies in melatonin, which means hormone problems. And all of that is part of depression. So it's not just one cause. There is many things that play together to create that. Now, when we look at which ones actually are influenced by PEMF, you know that the imbalance of neurotransmitters is greatly enhanced, or the balancing. Then nutritional uptake is greatly enhanced. Allergies and food sensitivities, not. And I put a question mark in because it activates your immune system and it activates the healing process. So if you have leaky gut, which causes those food sensitivities and allergies, the healing process is expedited, but you still need to change your diet. And it's actually one of the things, as every time I explain PEMF, I say, it doesn't compensate for a bad diet. It doesn't compensate for you cheating and eating chocolates and sweets and foods that you shouldn't eat, like dairy and gluten. But it will help with everything else. And that's pretty much true. So you can see congested liver detoxification is huge, enhanced. Methylation, we said, it doesn't repair your DNA, but it helps bypassing and the absorption of nutrients. We know there is quite some phytonutrients that we can use to activate your DNA impairments or to bypass them. And the nutritional uptake is greatly enhanced with PEMF. So not really, but still it does help. Lack of exercise. PEMF is, when you use the PMT, you can actually have sore muscles. You can feel the next day as if you had exercise. So that's definitely working. And for the oscillating machines, it also has a massive energetic effect onto your cells, which feels like exercise. Toxins, we know. Stress, we know from the relaxation, from the low frequencies. Deficiencies in melatonin, that's something that you will realize that all your hormone glands, especially adrenals, thyroid, there will be increased activity. You just need to be careful. Don't overstimulate them. We know that as soon as we get a little bit of energy, we start to exhaust. It's a gradual, slow motion buildup, and you have to restore and reserve your energy. It's like gold treasures that you don't want to spend straight away. So just build up slowly. As you increase with PEMF, you will see that it builds up, but be careful that you don't exhaust yourself as soon as you feel a little bit better. And then hormone imbalance, I said before, and then here lack of sleep, and this is one of the elements that every single time we go to a workshop and clients have PEMF treatment during our workshops, because we always have those devices with us, they come back the next morning and say, well, first time in years that I've slept so deep. Oh, I had no pain all last night. Actually, this is one of the reasons why we sell so many machines. When people have the possibility to try them, and we've been at workshops, I had clients that brought cash the next morning to take the device home. Many times, not only once. It is very convincing. Once you had that treatment, you know it helps. Dr. Pavluk wrote on his website, when you have depression and you use it, a 20-minute treatment, you have a 10% significant improvement in mood. Now, I don't see it as such a fast process. Yes, you feel a lot better because your energy levels go up. And every time you have more energy, you feel better. But I wouldn't say that that's directly linked to reduce of depression. It's a treatment that you would do, for 2 months, daily, every second day. You build up more and more. And as you build up more and more, your resilience, you build up your hormone glands and everything, all of a sudden you will feel so much better and your body truly heals. And I guess this is one of the effects that you will realize that we focus a lot more on. We don't want just a quick fix and then we override the problem and create 10 more. We actually restore health very systematically so that we have a very beautiful feeling and we feel 10 times better after a certain time. Osteoporosis, very, very important. It's something that you will notice with the dinosaurs that we showed in the beginning. High vibrational energy, and we know that when we say to children, jump on trampolines when they are little, bounce and jump, it hardens your bones. Well, that's pretty much true, and it does the same when you use it for osteoporosis. There is on PubMed many research studies that show as soon as you increase your bone density with vibrational energy, with magnetic energy, your healing is greatly expedited. And in sports fields, or when you work in the sport industry with sport clubs, and we have many sport clubs, soccer clubs, health clubs, rowing clubs, high jumping clubs, whatever they are, they use PEMF, and directly after injury, when the client had a strained ankle or any kind of tendon that they damaged, they wrap the rope around or they put the loop around and then they start treating, because it reduces within a very, very short time all the inflammation, it increases the healing process, and it concentrates that bone density. So when you had a broken bone and you use PEMF, again, Dr. Finn Scott Anderson showed that very clearly, your healing process is expedited by factor 2, and that's very powerful. Dr. Rao showed me that they use that for bone density in jaw bones. When you have your jaw and they pull the tooth, and from that tooth, it was not cleaned underneath. The bacteria was still in there. Then first the gum closes, and then the bone closes, but the bacteria infection is still in the bone. Then they start eating up that bone, and those bacteria are deadly. They produce thioethers, and those are toxic gases. I call it a gas that is then transported into the bloodstream. So cavitations are very dangerous for cancer patients in general. But what they do is they eat up the bone, and you can see that in those dark shadows in your scan. Or if you have a cavitat device which takes then a shot of your cavitations. But what Dr. Rao does, as soon as they pull the tooth from someone, they take them into a room which is, I think, six or seven PEMF devices, and they immediately after treatment have white blood cells concentrated out of the plasma. They pull blood, and then they create like a gelatin. They fill that into the hole. Then they close up the tooth, and then they put the client daily for 20 minutes on PEMF in that frequency of 5 to 7 to 8 hertz, which always goes up, down, up, down. You don't want stagnant frequencies like a magnet, because it will not heal. You need movement. Movement is life. So they use that PEMF to increase the bone density, and within 2 months, very short time, they can actually build implants. and zirconia implants, and then put a crown over the top. So it's used in dentistry, it's used in sport, in many different areas to increase bone density. And we've just put a chart together. See, this is how we work in our coaching program. When you look at any kind of those diseases, we don't look at the disease, we look at what causes the disease. And one of the big factors is diet. Again, PEMF won't have an influence. One of the big things is also your medication. And if you have strong medication, you won't be able to reverse that. Many of those anti-reflux medications or steroids, they destroy bone density. So if that's something you take, like your diet, then PEMF won't have a big influence. And a lot of people say, oh, my PEMF, it didn't make a big difference. Yeah, it's to do with still taking that, still being on an unhealthy diet, and missing a lot of the nutrients. See, to increase bone density, you need to have adequate or high levels of vitamin D, vitamin A, C, E, D, K. K to help vitamin D with the calcification of the bones. Otherwise you get arterial calcification. So the nutritional factors are super enhanced with PEMF. And if you then have the right diet and the right supplementation, all of a sudden this works. It's also good with lead and cadmium are main reasons for osteoporosis. So you detoxify heavy metals. And then a lack of movement, which we said it's like exercise. Now, one of the other reasons that causes osteoporosis is hormonal imbalances. And we know when estrogen levels reduce, when the sex appeal after menopause goes away, that's when osteoporosis happens. And if you can use PEMF in the right way, then you will increase those hormone glands to still work properly. One of the effects that we always say, and this is why I little put love hearts, we have several clinics that use it for incontinence. And what they noticed is that when a lady sits on that loop and they have incontinence treatment, all of a sudden their hormone activity increases and their libido increases. So it's like a double effect, which is very pleasant, and it helps prevent the osteoporosis. So combining it in that range or understanding how it works there is really helpful. PEMF in sleep, I think I've covered a lot in that regards. We go at night through sleep cycles. And those sleep cycles, they're bright awake, and then we fall into alpha relaxation, then into the theta state, then into the delta state. You can see we're not a lot in the delta state, but we go down and then we go up. And that's our REM cycles, rapid eye movement, resolution of all your memories, emotions, learning, everything, and then you go back down to the next. So it's 9 sleep cycles that you go through. And during those REM cycles, you resolve mind and emotions, and during the theta and delta, you repair and heal the body. And that's why at nighttime, when you have an increased energy level of sleep, then all of that is greatly enhanced. First of all, you bring yourself to those deep delta and theta levels, which is very helpful. Secondary, and this is one of the elements that I learned from Dr. Risa Samvat, and I really have to be grateful for his teachings. He wrote a stunning book about sleep. Sleep is like a bank account, and you can't catch up on sleep. It's very necessary that you have your 6, 7, 8, 9 hours during teenage hours. You know, you need that time to sleep and recover. And as you use up too much sleep, no, the other way around, if you have not enough sleep and you use up too much of your energy, he said it's not possible to catch up. You go into a deficiency, it's like a minus in your bank account that you can't pay back. And that's why it's so important to really have healthy, sound, deep sleep. And they run a sleep clinic and they use PEMF beforehand to energize, because it's quite exhausting during night. Your body needs to heal and repair and detoxify and to mend everything. So if you're too exhausted, what happens? You lay in bed, you roll around, right, left, restless leg syndrome, and you can't fall asleep. only when your body has managed to build up enough energy, when you really have that, restoration, that's when you fall asleep, and then your body starts actually a very hard work to fix you. So increasing that with PEMF before you go to bed will massively enhance your sleeping quality and your healing quality. And that's why we use it in the morning with our so-called wake-up program, going from low frequencies up to high frequencies to stimulate your system and get you going. And at nighttime, we do it the other way around. We bring you down and you balance out on those low frequencies that allow healing of nerve repair and bone and detoxification. So it's a great way to use twice a day without any kind of problems, and to help you with healing during sleep. There are many more treatments, and degenerative diseases. If you look at any kind of incontinence, there is little muscles here on your rectum. There is, for females, very often incontinence problems when the tummy becomes too heavy and causes too much pressure on your bladder, and the muscles lose their toning. So all of that is, with age, a quite normal process. But when you start now using PEMF, and you can use it for animals and adults, and you just sit on that loop and you start pulsing strong energy waves into it, you get muscle contractions. Now, the first 2 or 3 times you might actually feel you're exhausted. You had like a workout in an area that usually doesn't get a lot of workout. It's like in yoga, you have those postures where you sit and you cramp your tummy muscles and your thighs together. That's a training to prevent incontinence, but with that PEMF machine you do that involuntarily, and that's why the PMT 120 is actually used as a device for incontinence. And when ladies use that and they sit on that loop and they have those muscle contractions for, let's say, 15 minutes, and they do that for a few times, 10 treatments each 3 rounds or 4 rounds, their incontinence goes away. And this is a phenomenal relief. Walking around in diapers is sometimes not really sexy. And if that can be stopped, in the same way, if you have prostate problems and you activate that area, you create massive detox, which we know is one of the main reasons. You reduce bacteria load, which is with an increased immune system working, and you increase oxygenation in that area. All of a sudden, I have guys that don't do a lot else. They don't really change a lot of diet and they have no other treatment, but they have this device and they sit on it and have, let's say, 4 or 5 treatments a day with PEMF, and they pulse, and all of their problems have reduced, and some of them have even gone. So it's a treatment that will help in many ways. And again, let me go through the chart. This is from our app. What causes degenerative diseases? It's gut health. Well, we know healing is a little bit of a factor, but as long as you eat crappy food, it won't help. But it helps with inflammation, it helps with deficiencies, it helps with infections, with an increased immunity. It helps with toxicity by blowing out all those toxins. If you combine it with binders, it helps with systemic health, activating your liver, activating your kidneys, your adrenals. It helps with hormones, as we just said. And in form of the strong device, it even helps with cancer treatments because it really overcharges your cancer cells, and psychological health as well. All of those factors, look, all of them green, enhanced with PEMF. So that's why we use it as a mandatory treatment for all of our coaching clients. It's something that when you have, you will feel so much easier to process and to work and to enhance all other treatments, whether that's your IV treatments or your detoxification process or your supplementation. You know how many people poo 90% of their supplements directly into the loo or into the toilet? Well, that's changed as soon as you start using PEMF and you do it wisely. And now we'll talk about which device is best for which type of practice and which type of disease in the next video.